Hello, everybody, and welcome to learning about how to optimize your health in pregnancy. I'm Dr. Jenna Priestap, and I am here with Dr. Shelly Ordon. Shelly is a naturopathic doctor, naturopathic doula, and creator of the DIY Doula Program and co-founder of Naturopathic Doula Group. Shelly, can you tell us, Dr. Shelly, can you tell us more about yourself?
Sure. Thank you so much for having me. So, my name is Dr. Shelly. My clinical focus is fertility, pregnancy, postpartum, and pediatric health. I see lots of different people. So, things like digestion and hormones as well. I think it's all so much related. But I am a naturopathic doula. I am a co founder of Naturopathic Doula Group, which is really also like a very new and exciting platform, a rebrand of York Region Naturopathic Doulas. And I am the creator of the Do It Yourself Doula Program, which is a program I created in COVID when doulas were not able to enter into the birthing unit. And it's just a really great way of teaching, both people, partners especially, how they can support the birthing person during labor and delivery. So thank you so much for having me. I'm really excited to be here. I love talking about pregnancy. So I'm just excited to share my info with you, my insight.
Yeah, it's so great that you came on. And that everything just I feel like you encompass everything so well. Like that program sounds amazing. And being a naturopathic doula as well, you can really truly support your patients. Not only
Totally. It's really cool. Like it's awesome. Like I work with uptown midwives. So like I find that like also just having the connections like with the midwives, like just so many people coming my way. And there's so many things you can do to like support and optimize pregnancy. So it's like, why not? Like if
yeah,
there's ever a time that you want to be like your healthiest self, I would say that in pregnancy or, kind of when you're thinking about getting pregnant, like this is sort of the time. Right. So
yeah.
anything that I can do or like another naturopath can do to help, it's like amazing.
Yeah, I love it. That's so true. And especially one big thing is going to be diet. So, do you have like what would you say is the most common dietary recommendation you make for people in pregnancy?
You know what? It's so interesting because when it comes to diet, like in terms of like caloric intake, like a person only needs an extra 300 or 400 calories a day. My biggest thing when it comes to diet is like trying to minimize the prepackaged foods, trying to minimize the processed stuff as much as you can. You're only a human. If you're going to eat something like that, it's okay. I always say like acknowledge, accept, and like move on. But if you can incorporate or adopt more of like a Mediterranean diet, I always say like that's the best because the Mediterranean diet is really like it's well studied. We know it's really effective. We know that it's great for fertility. So we know that it's also great at really just maintaining pregnancy and supporting pregnancy. And it's easy because we're not talking about removing and restricting anything. It's really centered around healthy fats, lean proteins, complex carbohydrates, and lots of fruits and vegetables. So when I work with my patients, I'll tell them, like, if you think of a plate and you want to do like a plate method, right? Like eyeball serving size rather than having to count and measure because that's not necessary. But just sort of having this idea of a plate and thinking like half is fruits and veg, a quarter is protein. Usually, where there's protein, there's healthy fat. And then another quarter is your complex carb, like quinoa, brown rice, sweet potato, etc. Right. So that in terms of diet is really all you're looking for, just keeping it really simple, trying to remove that sort of extra stuff that you might want to just sort of be thinking about, like the additives, the preservatives, the food colorings, the dyes, like trying to really remove yourself from those ingredients and just trying to be more like whole foods. Again, as much as you can because we're only human and we can only do the best that we can and everyone is different and in a different situation, but any small change is going to be helpful. It's going to be supportive, right?
Mhm, mhm. No, and I think that's perfect because there's enough things on your mind as a pregnant woman that just
Yeah.
keeping it that simple strategy, I think that's great.
Totally. Like when I say, like when it comes to liquids, I'm like, just like make sure your urine looks like pale yellow or like clear. Like then you're drinking enough like fluids. Like you don't have to worry about like, am I getting 8 cups in? Am I drinking enough? Like, your body can give you the signs and the information you need into
Yeah,
whether or not you're getting enough. It's really just about becoming in tune with your body and like
yeah,
listening to when it's speaking to you and just sort of fueling it and nourishing it as it needs, right?
yeah.
Small changes make big differences.
Totally. I think that's beautiful. In pregnancy, even just in trying to conceive as well, it's just such an important time to tune into your body and be
Yeah,
aware of those signals and stuff. When it
totally.
comes to something such as gestational diabetes, what
Yeah.
would you say are some strategies that can be used to like prevent gestational diabetes? Or if you've already been diagnosed with it, which it happens, like what about managing it? What do you recommend?
So, you know what? That's a really good question because obviously a lot of people are concerned about gestational diabetes, especially if they're like with a midwife, maybe they want to have like a home birth. Because when you hear gestational diabetes, they often are also talking about things like induction, and for some people, that's like a big deal. So, going back to diet, I find that when eating more whole foods, following that Mediterranean diet, because again, it's really well studied. We know it's great for blood sugar. We know it's great for cardiovascular health. That alone can be the difference. But sometimes, it's not only about diet, it's even about like when you're eating. So, like, consuming like regularly spaced out meals, like making sure you're combining like proteins with a carb or a fiber with a carb, because proteins and fiber can reduce the overall glycemic load of a particular food, right? And then that's going to help stabilize blood sugar. Working out, exercise, even if it's just walking, right? Because again, depending on how you're feeling in pregnancy, you might not really have the energy to go and do like a lot of physical activity, but even something as simple as like 30 minutes a day at walking, that can help stabilize blood sugar. Supplements are great as well. I mean, sometimes I'll have patients, especially if they had something like if they have PCOS, like in like pre-pregnancy. So that's something we're thinking about. We're already thinking about blood sugar. I might supplement with something like inositol. I might supplement with chromium. That's another really common one that I will use. So, I will use supplements here and there, especially if someone's already been diagnosed. So if we're already managing and treating, but again, small changes can make really big differences. You just want to take like this kind of like an integrative approach. It's not just one thing that you can do. It's like a series of little things that you can do, right? It's just a matter of knowing what those things are and incorporating them into your day-to-day routine. But like I said, regularly spaced meals, like pairing the foods, incorporating exercise, those already are really great strategies. Managing stress,
Yes.
cortisol increases, right? When cortisol increases, it actually plays with blood sugar. So managing stress might be sort of more of the focus and less about blood sugar regulation, but more about stress management, because by addressing that, you're getting this like, rolling effect, this domino effect, of improvements, which is amazing.
Yeah, exactly. Like addressing the root cause of it
Yeah.
is actually going to be the stress instead of just
Totally, right? So it's all about having an assessment first when it comes to like these kinds of things, especially if you think about like supplements or whatnot. It's like actually having an assessment and understanding like what is going on with you. When you like are in it, it's hard to see, right? Like what's going on. Like as a naturopath, it's so cool because you're an outsider, you're like collecting all this information, you're looking at test results, right? Or you're asking for testing to get done so you can really understand what is going on, right? So someone who comes to me with maybe like a history of like blood sugar issues, maybe gestational diabetes, was something like their mom had, and like we can address that earlier on. We don't have to wait until like 25 weeks, 26 weeks, when they start talking about like glucose challenge, right? Like, and starting to do like the oral glucose test. Like, we don't have to wait until then. We can start addressing things right away. So it's like just figuring out what's really going on and
Mhm.
addressing that strategically from the beginning. That alone can support pregnancy, can prevent gestational diabetes, right? So it's also just kind of doing the work
Mhm.
if it's necessary.
Yeah, totally. And I totally agree that having an assessment, because what's going on with one person isn't necessarily going to be what's happening with someone else. And
Yeah,
having a personalized protocol is so
exactly.
important.
Like not everyone's going to benefit from inositol,
Yeah,
right? Or like
exactly.
not everyone's going to get or like, the brand that you
Mhm.
want might be different because some products have different things inside. And like, for one person, you want certain ingredients. And for someone else, it might be a matter of like a different dose.
Yeah.
So that assessment's really important to collect that information so that as a practitioner, you can come up with like a really strategic plan,
Yeah,
right?
exactly. And working with someone who truly understands what's going
Yeah,
on. He's able to put all of the pieces together of what's
totally.
happening with you personally.
Exactly.
Mhm. So knowing what's happening with the person specifically is super important. Are there any supplements that you commonly recommend with?
Totally, for sure. I mean, like a prenatal is obvious. When I talk to patients about prenatals, it's all about looking at medicinal ingredients and non-medicinal ingredients. I mean, I know that today you can go to a health food store, you can go online, you can kind of Google, and like lots of different products will come up. I think it's really important to learn how to read the ingredient list. So if you're not working with a naturopath and you're going on your own, I think it's important to understand like what are the different forms you're looking at for vitamins and minerals, because they're not all equally bioavailable. They're not
Exactly.
equally absorbed. So you want to make sure you're getting the most bang for your buck and actually absorbing the
Mhm,
supplements that you're like making the effort to take.
mhm.
Right. You want to look at the non-medicinal ingredients, right? So you want to make sure again that there's no like additives and dyes and colors, and like you would be surprised at
Yeah.
how many of the generic prenatal vitamins have that kind of stuff inside of them. So
Mhm.
like they're great, they're one a day, but they don't have great products inside, like ingredient wise. And like, that doesn't necessarily make them the best prenatal. So I do love a good prenatal. I think that, of course, that's like a number one. A DHA, like a good fish oil, would be really important. Again, the dose depends. I think that DHA is really essential because we're talking about brain development, like fetal brain development. But depending on what's going on, that EPA ratio is something that I do look at and consider. A probiotic.
Mhm.
Those are probably my most three commonly, like everyone gets on a prenatal, a fish oil, and a probiotic, because
Mhm.
we know that probiotics are so well studied. We know they can prevent like even preterm labor, like low birth weight, obviously the atopic conditions like in baby. They can help prevent like GBS positive status, right? So the need for antibiotic in labor. So, probiotics are also essential. There are other supplements out there. I mean, there's tons of other supplements that exist that are safe in pregnancy. But if I had to tell you my top three that pretty much every one of my patients will get, we're talking a prenatal, a fish oil, and a probiotic, definitely. Again,
Nice.
at some point things change. Like a magnesium might be a good one, or choline might be a good one. And it depends on the time of year when someone's pregnant. Like I might do some like echinacea in there, but those are not necessarily common supplements, right? It just those are more like case dependent.
Yeah, exactly. And I think that's good that you have that foundation of pretty much most or all pregnant women are going to need those three. And then depending on what's going on, again, having that personalized protocol in the assessment. What's going on?
Yeah,
Okay, now constipation is a piece of it. Okay, yeah, and maybe now we'll
totally.
we'll add in magnesium
Totally.
or something. Yeah, instead
And
of
like
just
that's the thing. It's like less is more, right? Like
yeah,
in pregnancy, especially, like less is more. You don't want to necessarily give your patient who's like having morning sickness and constipation and fatigue six different supplements because
yeah,
it's too much. They're not
yeah.
going to take it. And then they're not compliant, and then they're not going to feel good. So sometimes, you're incorporating other things. Like I do a lot of acupuncture with my pregnancy patients. You know what I mean? So like it just depends on like what is going on. But yeah, like personalizing things is so key
Mhm,
because
mhm.
it's just not one size fits all. It's just not, right? Even like I said, the brand, right? Like even the type of fish oil or the type of probiotic that I'm going for, it could be very different,
Yeah.
right? It's not just like, oh, my friend took this one, so I'm taking it. I mean, that's how people might come to me and it might start that way,
Mhm.
but like oftentimes we got to change things up because we
Yeah.
want to do what's good for the person, not what was good for your friend,
Exactly,
right?
exactly. Yeah, yeah, 100%. Yeah, that's
Yeah.
always it. Exactly. Well, thank you so much for coming on and sharing your wealth of knowledge. Is there
Thank you.
anything else that you'd like to say?
Thank you so much for having me. I mean, I don't think so. I mean, again, when it comes to pregnancy, my whole thing is like small changes make big differences. If you have the ability to add a naturopath to your team, it's so nice to have a second set of eyes looking at blood work, looking at your supplements, and making sure, like issues that are coming up throughout pregnancy are being addressed, that you're not kind of like suffering. You don't have to necessarily like suffer just because you're pregnant. Like, again, there are supplements, there are really great, safe things that you can do. It's just not everybody needs them, and it's not safe to go and just self prescribe them.
Mhm.
So, I think that small changes make big differences. Building that professional healthcare team, if you can, is so crucial. If you have the need, the want, to have like a sort of kind of a birth experience, if your experience is really important to you, like getting a doula in there is so good because they're so supportive. And like naturopathic doulas, we do a lot of work in pregnancy to support pregnancy. So some of the stuff we're talking about today as a naturopathic doula, I'm doing with like my doula clients anyway.
Yeah,
So it's cool to think about that too, right? So even if you're not seeing a naturopathic as a naturopathic patient, but you're having a naturopathic doula, there is some like overlap there in some of the ways that they can support you. So, I just think that naturopathic doctors are amazing.
I agree. I
We're
have to
pretty
agree
awesome,
with you.
and we have so much to offer.
Yeah,
And like, if there was ever a time to support someone, like it's pregnancy.
yeah.
9 months. It's like you want to feel good during those 9 months. You want to have an easy labor. You want to have an easy recovery. You want to feel empowered through it all. And like, there's so many ways you can do all of that. And it starts with diet and it starts with supplements and it starts with just like putting in the work and making the effort. Right.
Hmm. Yeah.
And I'm just like always so honored to be on the journey with people, like, when they're there, if they want to make the effort, I want to give them the tools to be their best selves.
That's beautiful. And that's
Yeah.
perfect. If anybody desires to connect with you, we will share all of your links and
Great.
everything. And
Awesome.
thanks again for coming on.
Oh,
I think
thank you
it's great.
so much. It was so nice talking to you today.
Yeah, you too. Okay. Well, have a great day, Shelly. Dr.
Thank you.
Shelly,
You
thank you so much.
too. Bye.